Thank you very much, Mr. President. I rise today to commemorate the 50th anniversary of Medicare. 50 years ago, on July 30th, 1965, President Lyndon Johnson signed into law the legislation to create Medicare. Mr. President, I say thank God for Medicare. It was a great idea 50 years ago. It was a great idea 50 months ago, 50 weeks ago, 50 minutes. And I stand on the Senate floor to say we must keep Medicare as Medicare, keep the integrity and solvency of Medicare. We cannot turn Medicare into a voucher. We cannot dilute it, phase it out, or eliminate it. And I will say to this, until my last vote is cast in the Senate, I will defend Medicare. I saw what this meant. In 1965, that summer, I had just graduated from the University of Maryland School of Social Work. Change was in the air. The civil rights movement was making its progress towards history and moving forward. There were beginning doubts about the Vietnam War. The nation was recovering from the assassination of President Kennedy. And President Johnson wanted to lead in a bold way, having had a landslide victory in which he said he wanted to create a great society. And he knew that a great society meant that we had to have a great heart. And what we knew then, as we know today, that people feared financial bankruptcy because of the health care cost. They were terrified that a heart attack that would end up in hospitalization would bankrupt the family. They delayed the idea of getting cataract surgery, which then needed to be done in the hospital, because they were afraid not of the surgery, they were afraid of the cost of surgery. For people over 65, if you were a small independent business person, you often had no health insurance after 65, whether you were in agriculture or an urban small business. Medicare changed all that. Medicare protected people from two things. Number one, it protected them so that they could have the doctor that they needed it when they needed it and the health care that they needed it. The second thing that it did is it protected them from financial disaster. Today, 55 million Americans, nearly every senior, has access to Medicare, including 1 million seniors. And what was so significant about that bill is it provided universal access to doctors. Number two, it had no barriers because of pre-existing conditions. Number three, it was portable because it was national. Whether you were Maryland or Utah or whatever state, Medicare was your national program, and it was viewed as an earned benefit. America at that time had many things going for it. One, we had a sense of self-confidence that we could really solve problems and meet the compelling needs of our country, and that the other, it had compassion. One of my guiding principles, and I believe then that guided the nation, was the guiding principle that honor thy father and mother. We knew that it was not only a great commandment to live by, but it was a good policy to live by. And therefore, we ensured that all Americans had access of health care regardless of their income. As I said, in the 1960s, 1965 was the year that I actually graduated from the School of Social Work. I went to a program called Responding for the Elderly's Abilities and Sicknesses Otherwise Neglected. It was called Operation Reason. Our job, a social worker and a nurse, one of my longest friends from school, our job was to help elderly people know about the program and sign up for the program and help them use the program. The joy, the sheer joy of people hearing about this program, where simply because they were American citizens, their needs with a modest premium could be taken care of. Part A was hospitalization, a safety net. And in those days, care for significant illnesses had to be done in the hospital. The advances of medicine, medical technology, now that where we do less in the hospital, I mean, the idea of cataract surgery and others being done on an outpatient basis wasn't there. So that they no longer had to fear the cost of hospitalization. And then there was this program called, a part of it called Part B, that meant that you had access to see a doctor, to see if you had diabetes, to see if you had high blood pressure, to see why you couldn't see those grandchildren or do your work on the family farm, the small business, or the factories when we had them in those days. And what you needed was maybe better eyesight, that cataract surgery. Maybe you were feeling old and slow, not because of that, but because you had diabetes or other consequences. And then, of course, there was the cost of the dreaded C word of cancer. Well, my colleague and I worked in the neighborhoods to make sure that we took care of how people could get to the facilities, know about those services, and know about those barriers. In those days, Baltimore seniors were struggling. When you retired, it was often the end of health insurance. It meant nearly half of the seniors were uninsured. They went to clinics, standing in very long lines, often shuttled back and forth from one clinic to another. You got your blood work here, and they looked at your kidneys here. They looked at your eyes there. Their concept of primary care was fragmented. Before Medicare, millions of seniors, as I said, were just one heart attack away from bankruptcy or one cancer diagnosis away from destitution. That was life before Medicare. Many were skeptical about Medicare. Once again, the other party fought it. They were wondering if Medicare was what that would mean. People were skeptical. Was this a big government move, or was it a big opportunity? My job was to show them that this program was not about big government, but about government with a big heart. After 4 months of operation, we had enrolled hundreds of people into this much-needed program. And what has it meant? Before Medicare, 48% of seniors had no health insurance. Today, only 2% are uninsured. Out-of-pocket costs have decreased. Before Medicare, seniors paid 56% of health care costs out of their pocket. Imagine what that meant if you were hospitalized in a hospital at those days at $500 a day. Life expectancy is now 5 years longer. Death from heart disease has dropped. Our elderly poverty rate has declined, and seniors have access to more affordable drugs. This isn't about numbers, and it isn't about statistics. It's about people. It's about people and what their compelling human needs are. It is about a government that says, I am on your side and at your side, and we are going to use our national resources, our national brain power, our national know-how to be able to create a program that you can participate in, and that at the end of the day, your life will be better and our society will be improved. I'm really proud of what the Congress and the President did 50 years ago. I hope we have that same attitude again. It's not about big government, it's about government with a big heart. And I will say this, there are those who continue to talk about ending Medicare. Just most recently, a presidential candidate who I think has incredible ability, Jeb Bush, said he wanted to phase out Medicare. I don't get it. How do you phase out Medicare? Do you start first with age? Like, do we phase out 90-year-olds? And then next year we phase out 80-year-olds? How do you phase it out? Or do we phase it out by disease? Okay, this year, no more diabetics. Okay, this year, no more cancer patients. Wow, they really cost a lot of money. What is it called phasing it out? And what do you phase it out to? Medicare cannot be privatized. We must continue it as a guaranteed benefit. Do we need to reform it, take a look at it, refresh it? The answer is yes. We have done that, like when we added Part B. But I will say this, no matter what, thank God for Medicare. And when you go around this country, no matter how they feel about government or about Congress, people love Social Security and they love Medicare. And you know what? We have to defend it. We have to make sure it is there as we need it. So on this 50th anniversary of Medicare, let's come together to make sure we continue to be focused on not big government, but where we have with the sense of self-confidence and a belief in our country to solve big problems, that we continue to act like a country with a big heart, and we can do it because we've done it in the past. So, Mr. President, I'll conclude by saying thank God for Medicare, and I thank God for the ability to be here on the floor of the Senate to defend it.